Hello, I'm Susan Dentzer, Senior Policy Advisor to the Robert Wood Johnson Foundation, and I want to welcome you to this First Friday Google Hangout. First Fridays are one way that the Foundation keeps people up to date with its activities, and today our focus is the Foundation's Culture of Health Prize. The prize is awarded to up to 10 communities a year. To date, 12 have won, 6 in 2013 and 6 in 2014. Today we'll hear how two past prize-winning communities, Santa Cruz, California and Brownsville, Texas, approached the work that won them the award. We're going to talk about what doors opened for those communities that won the award, and we're going to talk about some ideas for other communities that may contemplate applying for the 2016 prizes. The competition for those prizes opens next Monday, August 10th. We hope you'll send us your questions via Twitter to hashtag RWJF1STFry, that's as in First Friday. You can see that on the upper right-hand corner of your screen. We've got three terrific panelists on the Hangout with us today, so let me introduce them to you now. First with us is Abby Kofsky. She's Senior Program Officer at the Robert Wood Johnson Foundation. Abby helps to oversee the awarding of the Culture of Health Prize. Also with us is Kimberly LaCrosse. She's a community organizer and the project director at United Way of Santa Cruz County. And finally also with us is Dr. Rose Zavaleta Gowan. Rose is a physician at Suclinica, which is a federally qualified health center in Brownsville, Texas. She's also a Brownsville City Commissioner, and she's played a leading role in that city's efforts to create a culture of health. So Abby, we're going to start with you. First of all, tell us the purpose of the Culture of Health Prize. Tell us what distinguishes a community that wins the prize. And if you could, please share some key lessons from the past competitions that could help out the communities that are considering applying for the 2016 prizes.
Sure. Well, first, Susan, thank you so much for hosting us here today. It's an absolute delight to be part of the conversation with Kimberly and Dr. Gowan. I will tell you that the Culture of Health Prize is, for us at the Robert Wood Johnson Foundation, both about inspiring communities across the nation to build a culture of health, but also an opportunity for us all to learn about what does it actually take to do this type of work. Those folks who have followed the Robert Wood Johnson Foundation and followed our new vision around a culture of health may have heard our president and CEO, Risa Louisa Mori, talk about how we think about ushering in a new movement around a culture of health. And one of the ways she describes it, for me, is exactly what the Culture of Health Prize is about. And she says that it's often rare to recognize the beginning of great change when you're in it, because it presents itself as ordinary. It trickles in, cultivated by everyday people and communities across the country. But it is our job at the foundation and with our partners, to find those strongest examples of change so we can lift them up, and those change agents, those leaders across the communities, can join forces and build those small victories into a national movement. So the prize is very much about recognizing, celebrating those small victories, and really, bringing energy to what we hope will be a national movement. For us, prize-winning communities are exemplifying the criteria that we look for in the prize application process. And that means these are communities that are thinking about health much broader than healthcare. They're thinking about health in terms of what it means around education and jobs and the environment that people live in. They're thinking about not only health in a way that we traditionally think about healthcare, but recognizing the many, many players that it takes to improve health. Even today, we hear about the role of government, the role of the nonprofit sector, the role of those that are thinking about planning and zoning, education. So we know that in order to make change that is sustainable, we need leadership and engagement across the community. And it's change for everyone in the community. It's a change that provides everyone with the opportunity for better health, and that means paying attention to those that face the biggest barriers to health, that don't have the same opportunity, be it to healthy food or safe places to play. And it's thinking not only about one great program. While we want to celebrate those great programs or efforts to target one disease, It's thinking very holistically about how those programs and services fit in a broader ecosystem of health, the types of policy changes, environmental changes, and systems changes that need to take place throughout a community to create those opportunities for health. It's also certainly about thinking about sustainability in terms of using all of the assets in a community, not just grant dollars or not just funding for one program, but thinking about the untapped resources that might exist with volunteers and thinking about sustainability in new ways. And it's also, very much about harnessing and leveraging the power of data. Communities that use data to identify their biggest priorities and to track progress along the way. So in there you get a snapshot of what we see in our prize-winning communities and the types of attributes that we are looking for through the application process. Two brief reflections that I'll share that we see in communities that are excelling. These are communities that are applying as a community. They're bringing leadership from across sectors and across disciplines. So it's not one organization that we see applying, telling us about their individual work, but again, work that's happening across the community with leadership from many, many agencies, many organizations, and in many cases from the community and the residents themselves. And that for us is a trademark of what a culture of health is, because it really will take all of us. I know today we're going to have an opportunity to hear what a culture of health looks like in two communities, and I would say what we are learning is that it looks different from community, and we celebrate those differences, and the prize is very much about recognizing the power of local communities to make change, and recognizing that their journey is going to be as unique as the history, the culture, and the people that live there. And so, again, we'll hear two great examples today, and those are two examples that were relevant for those communities. And again, the prize celebrates those differences, but also those approaches, those criteria that really cut across. I will say we won't get into all of the details of the application process today. As Susan, you mentioned, we'll be releasing our call for applications on August 10th, and there will be an opportunity for folks to learn more about how to apply and also asking questions. We'll have a webinar in early September for those that are interested. I suspect there will be folks listening today that will hear themselves, hear their own community in the stories and think, wow, we are ready to apply for the prize, and we hope that you will take careful consideration of the call for applications. But for those communities that listen, leaders that listen and say, well, we're not there yet, we're also pleased to say that there are a host of resources across the foundation, and very specifically through the Action Center at the County Health Rankings and Roadmaps that can help communities take stock of where they are and how they continue their journey forward. So again, we're very excited to have this opportunity to talk more about the prize today.
And more information on that assistance from County Health Rankings and Roadmaps will be evident on the countyhealthrankings.org website, correct?
That's right. It will be there and also at the Robert Wood Johnson Foundation website at rwjf.org.
Terrific. Well, thanks so much, Abby. A great overview of the prize. So, Kimberly LaCrosse, we want to go to you now and ask you to tell us some more about what Santa Cruz did and United Way of Santa Cruz to help win the prize in Santa Cruz, the Culture of Health Prize, and what happened after Santa Cruz won the prize back in 2013.
Well, first I'd like to say thank you to each of you for having me here today and for the opportunity to represent our community, but also really just to be able to share what our experience has been and what we've learned from being a part of this amazing prize opportunity. I think that when I take a moment to really reflect about what we've learned, I want to share that the process of applying was actually an amazing discovery. We were able to look at our community in a new way. We were able to see the cross-sector partnerships, the non-traditional partnerships that we've created, and really be able to see the impact that already had on our community. We were also able to see areas that we need to grow and things that we're possibly missing from the work that we were doing. So, prize was really, like I said, an opportunity to sort of check in with ourselves as a community and And something that I've learned is that that's really a wonderful thing because our work is never done. So what I really want to share with other people is that don't look for trying to be perfect. Look for really sharing authentically who you are, who your community is. Because I think that communities have personalities like people, and really find ways to share the wisdom of your region, which is really, what are the social issues based in the evidence and the data, but what are the stories you can tell from the leaders, but also really from your community at its, most fundamental and basic level. The prize for us has deepened our partnerships. It's solidified our commitment. It's given us opportunities locally and nationally. And I think that more than anything else, we're all just committed to seeing the change that we want to see. And we also see the value of yes, the standout leaders, but really the grassroots leaders that are working, at the very core level of our community. So, an example for us would be that we have a community assessment project, and our community assessment project has been working for about 20 years to do a report card for the community, and we have used that to develop funding and partnerships, and that community assessment project is what continues to bring us together. So I think that's really a good basic response. I could say more, but I don't want to take too much time.
I think that's my introduction. Hello. Hello, and thank you to the Robert Wood Johnson Foundation for inviting Brownsville on this call, and welcome to everyone. My name is Dr. Rose Zavaleta Gowan, and I'm a practicing physician as well as a city commissioner here in Brownsville. Brownsville is a city of 185,000 people on the Texas-Mexican Gulf Coast border. It has been found to be the poorest city in the poorest county in the United States. The average age of our citizen is 29 years old, and there are 50,000 children in the Brownsville Independent School District. The median income is only $32,000 a year, and 70% of our people are either uninsured, with 1 in 3 being diabetic, because 80% of our people are either obese or overweight. That's 80. 85% of our people are Hispanic, and a team made up of the University of Texas School of Public Health, the City Health Department, and a local physician decided to make a difference, to make change to address the high rates of obesity and related illness such as diabetes approximately 10 years ago. Together, we've learned 3 things. 1, we had very little, if any, money, and there was none in the pipeline. So we had to develop cross-sector collaborations in order to develop and implement solutions. We worked hard to develop partners in the health sector, the education sector, the economic sector, the environmental sector, and the political sector. In fact, I ran and was elected to the City Commission in order to infiltrate city government. Secondly, Well, before that, we wanted to be inclusive in all of our programming and change that was accessible to all, as sustainable as possible, and we still do, and from the beginning to now, do nothing without cross-sector partners. Secondly, one brief example of a cross-sector collaboration is the Belden Trail. The Belden Trail is only 1 mile long, but it runs through one of the poorest areas of the city and touches 3 elementary schools. It forms the southern arm of the city's inner core hike and bike trail network, and it was designed with a hope of designing a model inviting trail so that all neighborhoods could look at it, experience it, and think, you know what, I'd like one of those in my neighborhood. But in order to build it and put it together, we had to find $800,000 without touching the city's general fund or budget. And we succeeded only because we partnered with an existing Ford grant that provided design and outreach services, the School of Public Health that provided more outreach services and support, B Metro, which is our bus system or mass transit system that provided sidewalks and bus stops leading up to the trail. The Texas Parks and Wildlife gave us our initial $150,000, and the Brownsville Community Improvement Corporation, which is our sales tax incentive corporation, and finally the Community Development Block Grant that provided additional funds for production. Thirdly, there have been meaningful benefits from winning the Culture of Health Award. To begin with, it was a validation of our work, the effectiveness of our Community Advisory Board, and the importance of working across sectors as outlined in our long-range plan that we call Imagine Brownsville. Secondly, it has led to the enrichment of unified efforts and the visibility of all of our partners. Thirdly, it has attracted more partners for us to work with. And finally, it has attracted the interest and resources of entities such as the entire University of Texas system, which is now developing a medical school in our area with strong public health direction. The Methodist Health Ministries, which is now working in our area on a collective impact project to prevent type 2 diabetes. The Legacy Foundation that is now working with us to develop bicycle tourism routes and outreach throughout the entire county. And MD Anderson and Rice University that have reached out to work with us now to increase access to care, improve healthcare delivery, and educate our providers. These are only a few of the benefits that we've seen. Thank you.
Well, thank you so much, Rose, and thanks also, Kimberly, to you. So as we heard, first of all, from Abby, the whole point of the prize is to inspire communities. And in fact, it sounds like that's exactly what happened, certainly in Brownsville and in Santa Cruz. And the prize has amounted to a celebration of those communities that have worked, in some instances, against many long odds to improve health. As Abby said, the point is to reward and acknowledge and celebrate communities who've taken these very holistic approaches to improving health and understand that health has many different manifestations. It's way more than just health care. It's also, do people in the community feel validated? Is there emotional connection and support? And many, many other aspects of health that goes along with that. In both instances, both in Brownsville and Santa Cruz, as we've heard, there was a lot of cross-sector collaboration. Lots of different elements of the community came together, both to improve health and also to apply for the award, that there was attention in both of those communities to those who are most vulnerable and in need of the most support, and that there really was a focus on changing the system to benefit people, not just one organization taking the lead and taking credit, but the community as a whole coming together to induce change that led to greater health. We again heard that a lot of benefits accrue from winning the prize, and Rose certainly elaborated on what had happened in the case of Brownsville. Abby, I want to go back to you and ask you also, do you have a sense from your perspective what kinds of things have happened in some of the other communities that have won the prize? What has it done to highlight them and give them greater visibility for their efforts?
Sure. Well, I'll reiterate, a couple of points that Rose said, because we are hearing this from many of the communities. One, it's an opportunity to recognize, celebrate, in many ways thank and acknowledge the partners that are often, so committed to the work, so focused on the work that no one's really taking a step back to self-congratulate themselves. The folks that are, on the front lines that are engaged in this work aren't, those types of individuals. So we have opportunity to recognize all that we've accomplished. Isn't that, a special occasion? For many communities, both that have won, but also, as Kimberly mentioned, just going through the process, have shared with us that it's been an opportunity to re-examine where they're headed. It's an opportunity not just to take stock of what they've accomplished, and that's very much what the prize is about, but to also think about where they are going, where they move forward, how they take the successes that they've had, with the trail, with their farmers market, and think about how they apply it to new areas and new challenges in the community. And we're hearing a lot of examples of that. And then, of course, bringing in new partners. We're also finding, and we are really trying to be supportive of our prize winners as they say, our work isn't done yet. We appreciate the recognition, but we are still very much on that improvement journey, and we want the opportunity to learn from others. So we have been investing additional time and resources in thinking about ways on how we can continue to link and forge the learning relationships that we're hearing our prize winners want from each other.
That's great. So it occurs to me to ask, maybe I'll go to you, Rose Gowan, are there any downsides to winning the prize? It sounds like in the case of Brownsville, certainly there were mostly upsides. Anything that communities ought to be aware of as a potential downside of getting engaged in this effort?
Well, what we experienced was certainly great joy. But before the prize win, many of our programs kind of operated under the radar, incognito. Being more visible also brought additional attention from folks that may not believe in what we're doing, or the naysayers, as we like to call them. So that came as a bit of a surprise. However, we took it as a challenge and turned it into a positive, and we took the opportunity to listen to the naysayers and craft and understand reasons why they were wrong, and then promote those, so that a negative actually turned into a positive, making our arguments and our logic stronger, and making our collaborations tighter and more motivated to keep growing strong.
And what exactly happened? What did the naysayers say?
Well, they would say things like, oh, I can't believe you're doing XYZ program. Do you know how much that costs? We could be spending that on fixing potholes, or on a new street, or things like that, or that type of thing. Or they would say, well, you're doing this program, but it's not in my neighborhood. This is terrible because you're only choosing to serve the underprivileged, and you're not making it accessible to everyone. So we've turned around a lot of those arguments into positives, and made us even more strong in our determination to answer their questions in a realistic way.
Kimberly, what about you? First of all, if you could give us more of a sense of what's happened in the ensuing years since Santa Cruz won the prize, and then also, were there any downsides to winning the prize?
Yeah, I'll just share a little more detail. For us, we cross-sector really meant highlighting our work in the juvenile justice system, partnering with probation. We partnered with different advocates working on homelessness. So some non-traditional perspectives on health, just to give a broader idea of the work that we highlighted in our application. And so I think some of the downsides for us have been also that, of course, we're happy and celebrating our victories and our accomplishments and things that we've been able to do together. At the same time, that attention actually demanded really you know, the courtesy and the honor of replying to other people in other communities who wanted to know what we did and how we did it. And I know for myself, working with youth and the Jovenos youth that I work with, communities were calling me from all over the country asking for help and resources. And you know, the good thing about that is that now it's inspired us to write our own curriculum or toolkit called Growing Greatness, if you will, so that we can share our successes and what we've learned. But when it first started to happen, I did feel a little bit overwhelmed, honored, but overwhelmed. And so I think that, you know, if you call that a downside, that's about as downside as it gets. But really, you know, again, like Rose said, we turned that into something positive. And yeah, it's been a great process again for us to really dig deeper into, well, why are we so successful? And in that particular case, in working with our youth, what is it that we did differently that has had our work be so impactful in our community and so sustainable that, you know, we're able to see the impact that we have.
So, Abby, to go back to you, obviously many communities have applied for the prize in the last several years. Many of them have not won, but you've gotten feedback, as I understand it, that the communities really value the chance to apply, that it really does cause them to draw the circle a bit tighter of those who are involved in the community to try to improve health, and they can make real progress even if they don't win the prize. Is that right?
Heard that, especially from, you know, those communities that move into, you know, the second phase of the application process and then the site visit. You know, each of those steps does require the time and engagement of the partners and putting those materials together. So it certainly, you know, really in some ways forces those conversations. And I would say, you know, we continue to learn about the prize. This is we're going into now our fourth cycle, and every year we're learning more and we're trying to take our cues from the communities. And I'll say, you know, this past year was the first year that for those communities that moved into the second phase of the application process and then the site visit, we provide written feedback. Feedback based on what reviewers see in the applications. Now, of course, that's just based on what we hear from the communities. It's not necessarily a full picture, but we provide, you know, from across the national expert reviewers that read this, what they see as the real strengths and opportunities. We, again, also make the coaching, free coaching that's available through the County Health Rankings and Roadmaps Action Center, available for those communities that want to take that feedback and think about how they make it actionable. So we really have gone from just, you know, having a static application process to having it be an opportunity in and of itself that is about ongoing improvement and engagement.
And of course, those communities that win the prize do get $25,000 in cash. Does the foundation set any strings on what that money can be used for?
Well, it is an interesting note. I'd say oftentimes when we talk about the prize, we forget to talk about the $25,000 because in our mind's eye, it really is about the opportunity to elevate, celebrate, and, you know, learn from the work of this community. But yes, there is a $25,000 prize, and as you've heard, communities think about using that in different ways, and some have been quite innovative. We don't ask communities how they're using it. We don't ask for a budget, but of course, because the dollars are coming from the Robert Wood Johnson Foundation, you know, there are requirements that they can't be used for lobbying. That said, they do go to the communities, and like I said, they are using it to advance their efforts, to continue to engage partners. But unlike a typical grant program that folks know the foundation for, we don't ask for budgets. We don't expect ongoing reporting.
And I know in the case of Santa Cruz, Kimberly, you took some steps to divvy up that money among some of the various sectors that collaborated to improve health in the community, correct?
Yes. We decided that we would keep one, you know, small portion for our administrative costs here at the United Way of St. Cruz County, but then that we would share the prize with the primary organizations that help to really highlight their work and complete the application help coordinate the site visits. And so, for example, some of us decided to use that funding to attend conferences and build capacity and really reinvest back into the work that we're doing to further the sustainability of the work that we're doing.
So we have a question that's come in that asks, how do you create a culture of health that meets the needs of people of all ages? Kids are very different from adults. Now, of course, in the case of Santa Cruz, Kimberly, you were working with Jóvenes Sanos. You might want to say a little bit more about that. That was expressly involving kids in the community to improve health, among other things. But what else was done in the case of Santa Cruz to really address the needs of children as well as adults in the community?
One of the other initiatives that we worked with was Healthy Kids, and that was a project that continues, that is committed to all children in our community having health insurance. And I think that I would say yes, I agree that, you know, creating a culture of health absolutely identifies that the needs are different. But I think that we have to find the threads that are the same. If we're really committed to health for all, we can find similarities. And so, you know, focusing on one aspect of the community, like health insurance for all youth, doesn't mean that we're not looking at, you know, let's say hospice care or things like that, or you know, the homeless population, for example, having access to health care. Another outcome of the work has been that we were able to have a short-term care facility for the homeless who were not able to stay in the hospital. So we've been able to become innovative in our responses to things because of the partnerships. So we're not so siloed and having limited views on our responses and solutions to what is culture of health for all.
So we have another question that's come in from Kelly Griffin on Twitter. This is directed, I think, Rose, to you. We love your cross-sector collaboration on the community walk in Brownsville. You might want to say a little bit more about what that is. How do kids benefit from that, Rose?
I think that we started in Brownsville by looking for scientific data. The School of Public Health went out into the community to find out what was our biggest health risk, who are the folks within the family that drive the family. Is it a mom? Is it a dad? Is it a grandmother? We looked at the demographics of Brownsville very carefully so that we would know where we should be targeting our efforts. And when we did that, we found out that it's a very young community and very much centered on what mom decides. She decides most of the decisions of what you're going to eat, what you're going to do on the weekend, and so on and so forth. And so we targeted the school system and got very involved with the parent education groups, which number in the thousands of mothers that go on a regular basis to learn about what's going on in the community and different aspects of the community. We also targeted schools in terms of walkability, and hence, as I said, the Belden Trail touches 3 elementary schools. Some, one at the end of the trail, had a small neighborhood surrounding it, which you literally would walk 3 blocks to school. But they had to cross this abandoned rail line, which was very unsafe. And so people would drive their kids to school or send them on the bus to school, which was literally 2-3 blocks away, which was silly. But putting the trail in, we've seen and been able to document many more kids that are walking or riding their bikes to school. So one way we tried very hard to address children was by tapping into the school district and the needs of the children, as well as tapping into their moms, so that we could have an impact beyond that into their weekends and their nights and so forth. And we also developed, the School of Public Health developed a curriculum called CATCH, which is in all 3rd grade schools in Brownsville and many parts of Texas, the coordinated approach to child Health, I believe is what it stands for, and that throughout the third grade of every school, there's an in-depth curriculum that's taught around the traditional English, math, reading, and writing and such that involves healthy activities and healthy food choices and so on and so forth. All of our activities are geared towards families, and all are open regardless of what your income level is, and they're all free. So everything we do is geared for accessibility, inclusive from everyone from age 8 to 80.
So clearly, in both communities, Brownsville as well as Santa Cruz, the culture of health is truly a multi-generational culture. So, Abby, let me go back to you with a question from Robin Wilson that also came in on Twitter. How are communities in general coping with unexpected challenges when it comes to implementing policy or systems or environmental changes to advance the culture of health? How can you share with us some general observations about how communities address those challenges?
Sure, I'm happy to give you my thoughts, and Rose and Curly certainly might have others. You know, I think there's one thing that is unique in our prize-winning communities, and that is how they are building demand for these types of changes. Policy systems, environmental changes are not easy changes. They're not quick changes. They're the type of changes that require buy-in from a whole range of stakeholders. And what we see in our prize communities is that they know how to engage the community. They know how to turn the community out. And when the community voice is loud and it's unified around change and around a shared vision, it is much easier to make those difficult policy systems, environmental changes move forward. And like I said, that type of community engagement and that strong unified community voice in some ways is a hallmark in many of our Culture of Health Prize winners.
Rose, I know you alluded to some challenges that you had to address from naysayers earlier. Have there been additional challenges that you've had to surmount as well, particularly in the aftermath of winning the prize?
Well, I mentioned that I ran for public office, which I never intended to do in my life. But part of the reason that I did was because there was no one at city government level that was really looking at what the realities were with respect to health and the environment and all of that. And our health department director was trying to make an inroad, but there was no one above him that was really listening or really understood. It wasn't that they weren't listening, they just didn't understand it. In came the School of Public Health with data, with actual data of what does it mean when that many people are diabetic to the economy of the city. And then with my run onto the city commission, I was able to bring up the conversation in circles where things were being decided upon. And since the win, that has become a little bit more challenging, because some will say, well, you've had a nice run on health, it's time to focus on something else. And so we've been challenged to reach out to more of our public officials and more of our city administrators and continue that education in terms of this is why we need to keep moving the bar, because of the economy of the city, because of the educational system, because of the low dropout rates and juvenile delinquency, and so forth and so on.
And Kimberly, to you, again, additional challenges at making change at a systems level in the aftermath of in the couple of years that now have ensued of the winning of the prize?
I would say that competing priorities within communities, what comes up here, our community is actually quite similar to Brownsville. And we have had a lot of challenges around the economy. So high unemployment, low income, housing is very, very limited. We have multiple families living in one housing unit. And so, you know, working to make systems changes and environmental changes often don't see as a priority because they feel, for example, when we wanted to put in, we passed a policy in 2010, which is part of, I think, the reason that we won the prize. So the youth went to the city and said, we wanted a moratorium, for example, on fast food. The compromise was coming up with a new innovative policy that said all new restaurants have to have a minimal amount of healthy food options on their menu. So this is very exciting, being implemented by the city. Well, after a number of years of the community struggling, the city recently voted to make an exception to add in another fast food restaurant, basically citing that the economy was more important than the health. And I appreciate what Rose said also. It's that we've then been looking for data with our local health trust to connect the cost of an unhealthy community, right? Like, what does it cost to have people experiencing obesity and diabetes and other health issues who are, spending time at the hospital and getting services because they're not able to do well. So those kinds of systematic changes and environmental changes are difficult at that level. But I would also say that's where you can also have non-traditional partnerships. So what we did in response to that was connect with local market owners, connect with local restaurant owners, so that we could sort of continue to promote the policy, but also do that work directly with property managers and owners to incentivize them to make the changes in partnership with us, which has been highly successful with our Healthy Center Markets project and our Healthy Health project.
I have a comment, Susan, if I could just add one exclamation point to what Kimberly said. She's absolutely right. Those non-traditional partners are the only way to go. I mean, the best weapon you have in your toolbox. For instance, we have an open streets program that we call Ciclovia. And when we first began, we had a lot of pushback because you're going to close the street and it was going to impact the shop owners along the way and so on and so forth. Well, after we had one, we were able to prove that those shop owners made over twice the normal income on days that we had Ciclovia. So if we weren't looking for collecting that data, we would have missed that opportunity to garner more partners as we move forward. And it proved to the naysayers and to the city government that this was a worthwhile activity that not only increased physical activity, but also benefited the economy. And you have to find those areas of commonality to really move the bar continually forward.
Well, we're at the end of our time now for the Hangout, and I really want to thank all three of you. Abby Kofsky of the Robert Wood Johnson Foundation, Rose Gowan from Brownsville, Texas, and Kimberly Lacrosse from Santa Cruz, California, and the United Way of Santa Cruz, for really laying out for us beautifully what is inherent in applying for the Culture of Health Prize and how the Culture of Health Prize really does reward and recognize communities who are making wonderful strides against very difficult odds often to improve the culture of health. I want to thank you who've joined us on this Hangout today, and we hope you'll join us again on September 4th for the next First Friday Google Hangout. We'll be focusing on what it takes to have a culture of health in the nation's schools. So please join us next month for that Hangout. Thanks to all of you for joining us today, and have a great day.
Bye.